Hi, my name is Dr. Alex Karimov. I'm a neurologist, just recently started here, so I'm happy to be here. I'm originally from Russia. I did my medical training, at least part of it, back in Russia, and then did my neurology training in Arizona, and then I did subspecialization in epilepsy in Houston, Texas. I liked it from the very beginning, and I knew that would be my path, and I didn't even consider anything else. There are different types of seizures. Some seizures start from certain parts of the brain. We call them focal seizures, and they can produce a wide variety of different symptoms. Patients can have alteration of their consciousness. They can have some movements, purposeless movements of their limbs, for example, mouth. They can have abnormal sensory changes, vision, for example. And then sometimes seizures start from all over the brain, something we call generalized seizures, when people just shake all over and they lose their consciousness. This kind of represent sort of a medical emergency type of events. So that based on that, there are different presentations. Nowadays we have broad range of treatments available for epilepsy. First, of course, we start with regular medications. Nowadays we have almost 30 different anti-seizure drugs available. Almost every year we get one new drug approved, which is pretty exciting time. Nowadays we have a greater variety. We can choose among different options, and all back in the day there were very toxic medications that would cause lots of side effects. Nowadays the medications much easier to tolerate. There are less interactions with other drugs, so it's all better for patients, for their benefit, of course. And someone who is not responding to drugs, we can consider some alternative options, again, neurostimulation devices, and then surgical even treatment is also considered for some cases are resistant to drugs. Depending on the type of events we're considering, if we're talking about epileptic seizures, there are certain risk factors. For example, we always ask about birth history, if it's known, their development as children, because there are certain neurodevelopmental disorders that can predispose people to have seizures, history of major head traumas, any insults to their brains, for example, something we call febrile seizures. Children up to 6 years, if they have high fever and they start shaking, it's also a risk factor going forward in their life to develop epilepsy. Family history of epilepsy is also sometimes very important to know. So those are the major risk factors. Neurology, again, is a fascinating field. We deal with so many different diseases, involve the entire body. Sometimes it's sort of a puzzle that you try to solve and find out what exactly is happening. And with all the advancements in the field, so we have so many options available. So I guess really it's an exciting time now for especially my field. But patient care and their well-being is my absolute priority, and this is what I always remind myself every day, that's why I'm here, to help people.